Hello, everyone. My name is Raanan, and thank you for listening to my podcast. Today, we will be talking about mental health. I want to talk about education attainment policy, but specifically through the lens of psychiatric and mental health care. This isn't about degrees for the sake of credentials, and it's not about checking boxes. It's about whether our mental health workforce is actually prepared for the emotional, relational, and clinical complexity we expect them to manage every day. As healthcare administrators, we're often tasked with improving outcomes while keeping an eye on staffing shortages, burnout, and limited resources. In psychiatric settings, those pressures are even more intense. Patients are not just managing symptoms, they're navigating identity, trauma, recovery, and social instability. Research shows that educational attainment plays a meaningful role in mental health across the lifespan, influencing emotional regulation, coping capacity, and long term psychological outcomes, which underscores how deeply education and mental health are intertwined, not just for patients, but for providers as well. This makes education attainment policy especially relevant in behavioral health environments. Now, when we look at psychiatric care through the eyes of the students and early career clinicians, one theme consistently emerges. Education shapes how providers understand recovery, autonomy, and human connection. Damsgaard and colleagues found that psychiatric education is most effective when it goes beyond technical skill building and instead focuses on developing competencies that empowers personal and social recovery for patients. In other words, how clinicians are educated directly influences whether care feels controlling or collaborative, transactional or therapeutic. From a policy standpoint, this means administrators should prioritize educational pathways that emphasize relational competence, ethical reasoning, and reflective practice, not just task completion. Competency based psychiatric education has also been shown to improve confidence and clinical judgment, particularly in complex or rural mental health settings where providers often practice with limited backup. Targeted psychiatric education programs help clinicians feel more prepared to manage real world mental health scenarios, strengthening their ability to respond thoughtfully rather than reactively. This is critical in psychiatric care, where provider uncertainty can escalate risk, increase reliance on restrictive interventions, or erode trust between staff and patients. From an administrative perspective, developing an education attainment policy in psychiatry means asking different questions than we might in other specialties. Instead of focusing solely on academic degrees, policy should define core psychiatric competencies such as trauma informed care, recovery oriented practice, ethical decision making, and emotional self regulation, and also ensure that staff education pathways intentionally develop these skills. This might include structured psychiatric education programs, supported continuing education, clinical mentorship, or competency based training models that align with the realities of mental health care delivery. Of course, there are barriers: time, cost, emotional fatigue, and access to specialized psychiatric education can all limit participation. If education policies are implemented without support, they risk increasing burnout rather than reducing it. That's why policy design matters. Education attainment should be framed as a shared investment between the organization and the clinician, recognizing that well prepared mental health providers are safer, more resilient, and better equipped to support recovery, not only for patients, but for themselves as well. In closing, education, attainment policy, and psychiatric care is not about elevating credentials. It's about elevating care. When administrators align policy with evidence based psychiatric education, they create environments where clinicians are more confident, patients feel more respected, and recovery becomes a realistic goal rather than an abstract ideal. By grounding policy decisions in mental health, specific research, and lived clinical realities, healthcare leaders can support innovation that is ethical, sustainable, and deeply human. This concludes my podcast. My name is Raanan. Thank you, and I hope you enjoyed listening to it. We discuss mental health and improving mental health outcomes for patients that struggle with it. Thank you, and have a good day.